A very good evening to all of you. Myself, Dr. Prateek Garg. So now the topic is tumors of paranasal sinuses or nose. So we will having a very brief idea about the tumors. What are the important points and how they progress. So let's talk about inverted papilloma. Inverted papilloma. This is also known as Ringer's tumor or Cnidarian tumor. Okay. So inverted papilloma. This has been asked in the PGI, the Ringer's tumor, what are the other name of the inverted papilloma? So try to remember these two names. So what is inverted papilloma? It is a most common benign tumor of nasal cavity. So it is a benign tumor but pre-malignant. Okay. So it is a benign but pre-malignant. Inverted papilloma is a tumor where the epithelium invaginate inside, where the mucosal membrane epithelium layer, basal membrane, invaginate inside into the matrix of tumor. So suppose this is the tumor. So the mucosal membrane epithelium will invaginate inside the matrix of the tumor. So that's why it is known as inverted papilloma, also known as Ringer's tumor. So it is a benign disease but pre-malignant. That means there are 10% cases of inverted papilloma will turn into squamous cell carcinoma. And what is the problem with inverted papilloma? Once you resect this inverted papilloma, it has got a high recurrence. So inverted papilloma, even after surgery 4 to 5 years, again it will come back. And what is the reason of coming back? Because in inverted papilloma, we have to also resect the base completely. Suppose inverted papilloma, it is a most common benign tumor of nasal cavity. So it is most common benign tumor of the nasal cavity, mostly arising from the lateral wall of the nose. So suppose this is my nose. Okay. So this inverted papilloma mostly arising from lateral wall of the nose. So after removing of this inverted papilloma, so the polyps present in the nose, we should also remove the particular bony area from where the inverted papilloma started appearing or from where it is attached to the bony part. So we need to excise that also. So inverted papilloma is a papilloma where there is an invagination or ingrowing of the nasal tumor mucosa or epithelium layer into the matrix. That's why it is known as inverted papilloma, and it has got a high rate of recurrence. It is a benign tumor, but 10% chances are there that it may be converted into the squamous cell carcinoma. That's why it is also a pre-malignant tumor. And the most common site is lateral wall of the nose, so which makes it most common benign tumor of nasal cavity. What is the most common benign tumor of paranasal sinuses? If we talk about paranasal sinuses, then it is osteoma. Most common benign carcinoma, most common benign tumor of paranasal sinuses. And this is most common benign tumor of nasal cavity. It is benign but pre-malignant. So what are the symptoms? It causes unilateral nasal obstruction and epistaxis, that is bleeding from the nose. So how will be the appearance? The inverted papilloma will also look like a finger-like projection into the nose, like a bunch of grapes. So if the examiner asks me in the question, the patient is having unilateral blockage of the nose with polypoidal mass which are looking like a bunch of grapes or finger-like projections into the nose with a history of bleeding, epistaxis. So we may think of inverted papilloma. So the clinical presentation is like bunch of grapes. Sorry. So the clinical presentation or clinical appearance will be like bunch of grapes. Okay, or finger-like projection. Finger-like projection. not very clear, but you can write it down. Okay. So what is the treatment? Treatment is functional endoscopic sinus surgery. Nowadays, functional endoscopic sinus surgery is the most common modality of treatment. So we have to widely resect the tumor along with its base. It is the most common benign tumor of nasal cavity, which is benign but pre-malignant. 10% cases turn out into the squamous cell carcinoma. Most common site of origin is lateral wall of the nose, and the treatment is fast. Recurrence rate is very high. So this is all about inverted papilloma, also known as Naderian tumor or the Ringer's tumor. Let's talk about osteoma. So osteoma is the most common benign tumor of paranasal sinuses. It's again most common benign tumor of paranasal sinuses. What is the most common site? Most common site is frontal sinus or frontoethmoidal recess. Frontoethmoidal recess. So what are the clinical features? Clinical feature of osteoma, it may block the opening of the sinus. That particular sinus may be the opening of the ethmoidal sinus or the frontal recess, leading to that particular sinusitis, like the frontal sinusitis, may lead to formation of the mucocele. What is the treatment? Nowadays, again, most of the osteoma is being removed by the means of the FAST, that is the functional endoscopic sinus surgery. If osteoma is bigger in size, we can go for the Lynch-Howard approach. What is this Lynch-Howard approach? This is the external frontoethmoidectomy. What is external frontoethmoidectomy? Suppose this is my nose, this is my eyes. Okay, so what we will do in Lynch-Howard approach? So we will do the frontoethmoidectomy. So external, so we will put an incision like this, where we are cutting along the lateral border of the nasal bone to open up the ethmoidal and the frontal bone, and we will remove the tumor. So osteoma. So Lynch-Howard approach is also known as external frontoethmoidectomy. Osteoma is the most common benign tumor of paranasal sinuses. Most common site is frontoethmoidal region, or we can say frontal sinus, and most common type is ivory osteoma. Every point is important, so concentrate. Every point is important. This is very brief idea about all the tumors, but every point is important. Now, what is fibrous dysplasia? So the fibrous dysplasia, by the name itself, suggests there is over and over growth of fibrous tissue. This pencil is not working properly. So in fibrous dysplasia, there is overgrowth of fibrous tissue. Into the bone. So with the bone, osseous bone, the fibrous tissue is getting overproduced. Most common site is maxillary sinus. Again, this is fibrous dysplasia. This is a benign tumor. Most common site is maxillary sinus. The clinical symptom will be unilateral asymmetrical enlargement of maxilla. So patient will present with them prominence at the maxilla region because there is overproduction of the fibrous osseous tissue at the sinus level. So there will be asymmetrical enlargement of the maxilla. And what is the treatment? Treatment is a surgical excision and resculpting. That means we can't open up we can't left the wound. We will remove the maxillary bone, so we can't left the wound. So we have to again do some sort of plastic surgery, take out a flap and reconstruct that area. So treatment is surgical resculpting. The most common age group is young age group, and CT scan will show a ground glass appearance. Important point, it has been asked in the exam. So ground glass appearance in the CT scan is a typical feature of fibrous dysplasia, and it is generally unilateral. Treatment is surgical resculpting, and the most common site is maxillary sinus. And what is the most common tumor of maxillary sinus if we talk about the benign tumor? So any of the paranasal sinuses, most common benign tumor is osteoma. Most common benign tumor of nasal cavity is inverted papilloma. Then the last tumor comes is astheneoneuroblastoma. It is a tumor of olfactory epithelium. That is a tumor arising from the olfactory epithelium. It is a malignant tumor which is growing very fastly. It is having the neuroendocrine features, and the treatment is surgery and radiotherapy. So we will do a wide resection of the tumor. This tumor will goes into the orbit, will goes into the anterior cranial fossa, etc. So we'll do a wide resection of the tumor and followed by the radiotherapy. Now, what are the most common tumor, malignant tumor now? If we talk about the most common malignant tumor. So lips, we talk about lower lip mainly. So if examiner want to ask about lips, so lips, the most common tumor is squamous cell carcinoma. If we particularly say that upper lip, then it is basal cell carcinoma. If examiner asks what is the most common carcinoma of lip, then it is squamous cell carcinoma. What is the most common carcinoma? External nose, it is basal cell carcinoma, also known as rodent ulcer. Now, nasal cavity, again the most common carcinoma, malignant carcinoma is squamous cell carcinoma. Paranasal sinuses, again the most common is squamous cell carcinoma. We have discussed the most common carcinoma in head and neck is squamous cell carcinoma. Now comes the woodworker. The most common carcinoma in woodworker particularly is adenocarcinoma. So the carpenters, whenever they are working, a lot of wood dust is being inhaled by their nose, and that wood dust will get deposited into the paranasal sinuses, leading to adenocarcinoma. Important point. Now, the squamous cell carcinoma of paranasal sinuses. So again, the most common site of malignant carcinoma of paranasal sinuses is maxillary sinus. Maxillary sinus is most common site for paranasal sinuses tumor. It is again the most common site for fibrous dysplasia. We have read it just few moments back. So most common site of paranasal sinuses malignant tumor is squamous cell carcinoma is maxillary sinus. Exposure to nickel, chromium and leather industry. We all know in Agra, UP, Agra, there are a lot of leather work going on. So the squamous cell carcinoma paranasal sinuses, it's very common there. What will be the clinical feature? Clinical feature will be the nasal blockage, bloody discharge in the nose, followed by the lymph node, enlarged lymph node at the submandibular area or the upper cervical lymph node, that is the upper jugular chain. So the lymph node will be enlarged. What will be the treatment? Nowadays, FES, if the tumor size is small, then we can do with the FES followed by the radiotherapy. But if tumor is bigger in size, then we will go for Weber-Ferguson incision. So Weber-Ferguson incision, important, has been asked in the exam. So this is an incision shown in the picture. This is Weber-Ferguson incision. This is Weber-Ferguson incision. So Weber-Ferguson incision extending up to the lateral canthus of the eye and extending till the upper lip. So starting from the upper lip along the lateral border of the nose, medial canthus, lower eyelid and till the lateral canthus of the eyelid. So this is Weber-Ferguson incision, which is being used for any of the paranasal sinuses like the maxillary sinus, ethmoidal sinus, etc. What is Lynch-Howard incision? We have studied. So the Lynch-Howard incision is this. It is external frontoethmoidectomy. Lynch-Howard. So it is also known as external frontoethmoidectomy. The incision is like only opening the frontal and ethmoidal sinus, where the Weber-Ferguson incision, it is like this, bigger incision, followed by radiotherapy. Okay. Now there is one classification on-grain classification. So on-grain was a scientist which give a classification. He draw a line from the medial canthus going towards the angle of mandible. So you can see in the picture, this is known as on-grains line. Starting from medial canthus going to the angle of the mandible. So any of the tumor above this will have a worst prognosis. Any of the tumor below this line will have a good prognosis, because if the tumor is present above this line, so the tumor is in close proximity to the brain, close proximity to the eyeball, close proximity to the cavernous sinus, close proximity to the temporal lobe. So any of the tumor or the lesion which are present above this line having the worst prognosis. And the tumor which are below this line, below, will have a better prognosis. I hope this much is clear. Now, adenocarcinoma of paranasal sinuses. So we have discussed this is a most common carcinoma in woodworkers. Again, this is a malignant variety. Most common site is ethmoidal sinus and mainly present in woodworkers. Woodworkers. Again, there will be lymph node positive and bloody nasal discharge. Treatment is surgery plus radiotherapy. If it's of ethmoidal or maxillary, we can go for again Weber-Ferguson incision. Followed by radiotherapy. Now, staging of maxillary sinus, need not to remember so much, just a little idea. T1 limited to the sinus only sinus. T2 just the walls of sinus, like the medial wall is formed with the palatine bone. So extending to medial and inferior. If maxillary sinus only involving the medial wall or the inferior wall, that means the palatine bone or the medial wall, then it is T2. T3 if it extending or going posteriorly. So posterior wall of the maxillary sinus or the involving orbit. So T3 is orbit or pterygomaxillary fossa, or we can say the posterior wall, because we all know the posterior wall of the maxillary sinus is beyond the posterior wall of maxillary sinus there is pterygomaxillary fossa. So T3 is involving the orbit or the posterior wall, that means more complicated. Okay, and T4 is then advancing to the cribriform plate, sphenoid sinus, brain, soft palate, pterygomaxillary fossa, etc. Now the treatment of maxillary sinus, again the tumor is surgical resection, maybe the partial or total maxillectomy, followed by the radiotherapy. Weber-Ferguson incision or the mid-facial degloving approach can be